Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about osteoarthritis, the most common form of arthritis and a leading cause of disability worldwide. It's often called wear and tear arthritis, but we now know it's more complex than that. Osteoarthritis involves cartilage breakdown, bone changes, inflammation, and muscle weakness. And this all leads to pain, stiffness, and reduced mobility. To help us understand osteoarthritis and why it happens and what can be done about it, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine, is here to explain. Dr. Henderson, thank you.
Thank you. It's a privilege to be here.
So, what is osteoarthritis?
Well, osteoarthritis is a whole joint disease that affects not just the cartilage, but also the underlying bones, ligaments, synovium, and surrounding muscles. Over time, the cartilage wears down and the bone beneath it thickens. The bone spurs, called osteophytes, form, and the joint may swell and stiffen. This makes movement painful and can limit daily activities.
Is osteoarthritis aging or are there other causes?
Age is the strongest risk factor, but it's not the only one. Osteoarthritis is multifactorial. Mechanical factors like past injuries, obesity, joint malalignment all increase stress and cause cartilage problems. Biological factors like low-grade inflammation and hormonal changes also play a role. Family history and how joints developed early in life can influence the risk. So osteoarthritis, it's not just wear and tear. It's a complex disease with many contributors.
And Chinese medicine, what do they have to say about osteoarthritis?
Well, it's classified under the BI syndrome, an obstruction of energy and circulation caused by existential factors like wind, cold, and dampness. The result is pain, stiffness, and loss of movement. This is again one of those balance issues. Therapies may include acupuncture, herbal approaches, external applications, and movement practices. Modern studies show these methods help reduce inflammation, improve circulation, and even slow disease progression when used alongside conventional medicine.
Well, how would you diagnose osteoarthritis in your office?
Well, the diagnosis begins with patient's history, joint pain that worsens with activity and improves with rest. Plus, morning stiffness is a big clue, usually under 30 minutes. And on exam, doctors may feel creaking, swelling, or joint enlargement, especially when moving the joint. X-rays are the most common imaging tool, showing joint space narrowing, bone changes, and osteophytes. MRIs can give more detail, especially in early disease, and ultrasounds can show you the movement of the joint and identified sometimes when X-rays do not. Lab tests are usually normal in the early stages, but they may be done to exclude other types of arthritis.
So, conventional treatments are?
It's a stepwise approach. Lifestyle first, exercise, weight loss, bracing, and physical therapy are the foundation. Medications, topical or oral anti-inflammatories, and short-term injections can control the pain. We used to use corticosteroids, but those have been replaced with peptides. Surgery for the advanced cases and joint replacement can restore mobility and relieve pain.
Let's talk about the regenerative therapies you're doing in your office for osteoarthritis.
Well, thank you, because the regenerative medicine is a pretty exciting area here. We do a lot of joints. Regenerative cells injected into the joints allow the production of new cells. It reduces the inflammation, it releases healing factors and growth factors, and it protects the cartilage. Exosomes tiny vesicles, really teeny weeny ones, released by cells that carry signals to reduce inflammation and stimulate tissue repair. Prolo, the dextrose injections that trigger the body's repair response, strengthening ligaments and improving stability. You have platelet-rich plasma injections. These are concentrated platelets taken from the patient's own blood that release growth factors, healing factors, and reduce inflammation. And that supports the cartilage health. These therapies are still evolving in many practices, but used often in ours. It suggests that they can improve pain and function.
All right. What are the lifestyle steps that can make a difference in a person with osteoarthritis?
Lifestyle is crucial. Exercise, strengthening the muscles around joints, aerobic activity, and balance training reduce pain. This increases the synovial fluid in those joints and even helps it lubricate. The next is weight management. You don't want to get heavy. Knees and hips are those that are first affected. Joint protection, pacing activities, using supportive footwear, and bracing whenever possible for the knees helps a lot. Sleep and stress, good sleep and stress management reduce pain sensitivity. Nutrition, a balanced diet rich in plants, lean proteins, omega-3 supports the overall joint health.
What's the long-term outlook for patients with osteoarthritis? I know a lot of people, especially in this area where we're in Southern California, they go out to the desert because they have to have that dry heat. They can't be near the ocean. It really flares.
There's no question that weather has an impact. It varies with the type of a person or what the person has. You can have a couple and one belongs or wants to be in the desert and the one belongs in. So osteoarthritis is chronic, it's progressive, but I'll tell you, if you jump on it, you can slow the progression. And in most people with early diagnosis, if the lifestyle changes are made, using regenerative cells and things, you can individualize this care, and many patients can manage symptoms and stay active in their senior years. In advanced stages, joint replacement sometimes is necessary, no question, and is highly effective. Today, they're using robots to do most of it. The key is regular follow-up, tailored treatment, and minimizing the damage that would lead to those surgeries.
Let's talk about your mnemonic for osteoarthritis.
It's the word joint.
J stands for?
Joint pain and stiffness with activity.
O.
Ongoing management with lifestyle and therapy.
I.
Interventions, medicine, injections, or surgery if needed.
N.
New regenerative options, regenerative cells, PRP, exosomes, and prolotherapy.
T.
Take control with exercise, weight, and self-care.
Well, thank you, Dr. Henderson, for explaining this condition. It may be common, but doesn't mean that you have to give up on motility or independence. If you or someone you know struggles with joint pain, don't ignore it. Early diagnosis, lifestyle steps, and supportive care can make a difference. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.